Today I kind of wanted to talk about allergies.
Pets are allergic to many of the same things you and I can be allergic to.
Mm-hmm.
Many years ago, I had heard of a veterinarian that a person would bring a stool sample in, even if it wasn't positive for worms, he would still give medicine to the people, telling them that the pet had worms when it didn't.
Yeah.
Because he wanted extra money for the worm medicine.
Yeah.
If dog, primarily, and cats, if they come in and I am looking at its lower back, so from mid-back, the top, to the base of the tail, if there's scabs or sores or hair loss, I'll wager a week's salary that it's a flea or flea allergy. Just like human doctors, I mean, sometimes we miss the diagnosis too. I mean, I do the darn best I can. I mean, I do a lot of research and talking to other people, but sometimes, we just mess up.
Anyways, welcome back to the Language of Pets podcast. This is episode number 6. I have with me here Dr. Dan Lange. In case you guys forget, he is 44 years and 9 months.
Thank you.
Veteran.
Thank you for keeping that straight.
Yeah. Retired, but recently came back from retirement.
As the joke goes, I was told I was not doing a good job at home.
Yeah.
And maybe I should, if I wanted to save the world, maybe I should go back to work. And of course, doing the podcast, I mean, this is my passion. So
yeah,
I put my wife under the bus, but I'm glad I went back part-time.
It's a good excuse, right?
Yep.
Yeah. It's always good to indirectly blame somebody else for the decisions.
And it's kind of more entertaining, and saying, I just want to go back. You have to kind of add a little more spice to the story.
I have some, scars on my elbows here and the burn marks, but I tell people I got in a bar fight, or I had a tussle with a bear. So that always gets a little bit of a crackle from
well,
people.
That's what I do. If a dog comes in like with a broken nail or something, we have to pull off the shell of the nail, and then we'll put a bandage on it. And I'll usually tell the pet owner, now, we can't just say the dog had a broken nail. We have to say that it was in a wolf pack of 6 other wolves or whatever. And
fighting for
embellish
territory.
the story when people say, well, what's that bandage on for? So I like that.
It's all facts, Whether if it happened to that specific dog, we don't know, but it's happened before.
Right.
And we'll just take it and run with it.
we don't have to put the same story with the same pet.
Exactly. So, today, last episode, we touched up on, we went kind of in depth on
the
nutrition and diet for your pets, what to feed your dogs and cats, how to tell if your pet is putting on a little more weight.
Right. Well said.
And we didn't teach you we didn't say how to break the news to you politely, but
Well, if any pet owners would like to tell me how to do that, I say it tongue in cheek, but kind of have serious. What is the best way to discuss weight on your pet and not get you upset? Because I only do it as a medical, trying to help. If I have a large breed dog that's overweight, it's going to have much more issues with potential arthritis as it gets older. So there's reasons for our madness. But I really would like constructive criticism or thoughts. How should I bring it up? Or as I said in the upper episode, I would prefer that the pet owner asks, if your wife says, is she overweight, you can't answer that, husbands. But if your pet is overweight, I can answer that part of it. But anyway, I'd be interested how to proceed with that topic.
Yeah, seriously. So expert pet owners at home, let us know how you would like us, or you would like Dr. Lange, not us. I'm no expert here. But maybe in 20 more episodes,
yeah, exactly.
I
think you're picking up quite a bit.
Yeah, I'll be an expert by association. But let us know on how to properly address the weight condition of your
yes,
pets.
Please.
Yeah, that way he can, instead of him giving value and knowledge to you guys, he can in return, learn something.
Indeed.
Yeah, for the future.
Oh, I've learned a lot from pet owners. I've had a couple cases where I knew what I was doing, and then the pet owner looked at me, I think it's this, and I said, I think you're right. So I have learned many times.
Yep. Customer's always right.
Yep.
So, we touched up on diet and nutrition on that, and today I kind of wanted to talk about allergies, like what... us humans, we're always, whenever it comes to pollen season and the seasonal transition, we are always sneezing up a storm.
Yep.
Can never can never have both nostrils functioning correctly. And I find myself always having to turn to my side and then rotate to my other side when I'm sleeping, just so I can let gravity do the work.
Right. Exactly.
while I'm trying to catch my Z's. But I'm thinking pets are in the same thing, right?
Well, as usual, you brought up an excellent point. Pets are allergic to many of the same things you and I can be allergic to, but they show it much differently. They show it with their skin, dermatology.
Oh, really?
Classically, if somebody comes in, it's the middle of summer, like right now, we're getting toward the end of July. My pet is licking all its feet. It's driving me crazy.
Yeah.
My dog keeps shaking its head, and sometimes it's scratching at the ears, but they don't smell or the ears aren't red. It's just like they're really itchy. Or my dog does boot scooting. Now, it could be the anal glands, but in many, many cases, it's allergies. So if I get 1, 2, or 3 of those, and most commonly all 3, I know what's going on.
Really?
It's allergies.
So it's the same situation as me when I have alcohol. I get itch. No, I'm just kidding. I don't have the Asian flush.
You butt scoop, but I didn't want to bring that up.
No, everything but the last part that you mentioned. But no, a lot of my friends, because of the genes that we have, we tend to have trouble breaking down alcohol enzymes.
Interesting.
So we have what we call the Asian glow. So some of my friends, like one shot in or one sip of beer, they bust out in hives and they're all red all over, and they just can't take alcohol. Yeah. So they are a very cheap date, as I would put it. But no, enough of humans.
About Asian people.
yeah, that too. Let's talk about the pets that we have at home. So you mentioned those signs that are more on the surface of the skin.
Yep.
Right.
Yep.
Let's talk about itchiness. Like what's the difference between, like, you have fleas that the dogs are trying to just scratch off versus coming up or finding out that they have allergies?
If a dog, primarily, and cats, if they come in and I am looking at its lower back, so from mid-back, the top, to the base of the tail, if there's scabs or sores or hair loss, I'll wager a week's salary that it's a flea or flea allergy. But it primarily affects the back when it comes to flea allergies.
Okay.
I don't know why exactly, because fleas can bite anywhere, but classically they'll lose their hair on the back. And I had a good one, you and I had talked earlier, it was one that there was thinning of hair on the back. The pet was scratching its back, the dog was trying to get on its back, but I could not see any fleas on there. So they're small enough, you can see them, but a lot of times when they're moving is what catches your attention. And then, of course, like everybody else, fleas poop, and you'll see little black specks on their back, and that's flea poop.
Ugh.
They suck blood, and then the flea poop is actually food for the babies. This is very gross. If you're eating it all, please just hold on for just a few minutes here. Yeah. There is a reason why I'm trying to explain all this.
We'll blur your mouth and mute you while you explain this.
And I didn't see the flea dirt either. More. I'm sorry. I should have been more professional. It can be called flea dirt as well, but it's actually flea poop. But anyway, it's almost like a pepper shaker. Somebody takes a pepper shaker and just starts sprinkling pepper on the back.
Not the coarse type, right?
No, it's a very fine.
Okay.
It's very fine because, of course, fleas are relatively small, so their poop is relatively small.
Yeah.
Okay. But I did not see the fleas or the flea dirt, and I don't know, something just kind of hit me. I got a white paper towel. I put it near the pet or underneath the pet, and I just started scratching like crazy, and all of a sudden I could see these little black specks on the paper towel.
Seasoning.
Yes, thank you. I added a little bit of water, and because it's blood, you start seeing little red splotches. And it was mainly to convince the lady and kind of myself, your animal has fleas. Now, it was not really that obvious. And cats sometimes are so fastidious, they'll lick all the flea dirt and fleas off. So they come in, and I don't see anything at all.
Well, back to the nutrition. They're getting They're getting their
So
daily
So anyway,
intake.
the fleas, long story short, the fleas are primarily on the back end of the body, but a lot of animals are allergic to the flea saliva. That's what causes the allergy, allergic reaction. It's the flea saliva.
Okay. Okay. And then where else would you, or where would you put your money on if it's like a pollen allergy or the other
The other
cases?
environmental allergies, for the most part, there's not any way to decipher for basically. Now, if you have a grass or something allergy, of course, the dogs are walking through it. They come in and they're licking their feet because they can feel the pollen or the grass itself if they're allergic to it.
Mm-hmm.
So if it's kind of more feet, maybe it's more grass related. But for the most part, I can't differentiate pollen, that might be in the air, mold, grass. If the people are willing to pursue it, there are tests we can do to find out exactly what the pet is allergic to.
Okay.
But for the most part, if we're just treating the allergy by minimizing the side effects, which we do 90% of the time, 95% of the time, and we use different medicines for the most part, it really isn't important. If I can determine its allergies, then we just decide what medicines are we going to use to treat it.
Yeah.
Now, the dilemma is that allergies, like people, if you take like a Zyrtec or Claritin, you're not going to cure it. You're just going to try to keep the issues under control. So like you and I with the nasal congestion, coughing, sneezing, we hope to minimize those respiratory issues for those of us that are affected. Well, with the dogs, we're trying to prevent the licking or minimize it with the medications that we're using. But people get so mad a lot of times, okay, I'm going to give you 30 days worth of the medication. Let's see if the dog does not react to the medicine and gets the itching under control. And sometimes I forget to call them back, and they call me 5 weeks later and they say, well, the medicine's not working. Well, it's because if you stop it, the allergies are going to come back. And so I want to pass that point on, that often, depending on the allergen in your pet and where you live, you may have to go, from the middle of March or April till get a good frost in the fall.
And you got, they have to be on medicine for the whole full length.
Exactly.
Wow.
So it's frustrating to the pet owners, but again, it is not a cure. We're just trying to keep the pets comfortable with the allergens. And in many cases, allergens are a process elimination. I mean, what if the pet has mites, which are microscopic? What if it has a bacterial infection? What if it has a fungal infection? Well, treating it for allergy is not going to do any good. So sometimes we have to run tests to rule other stuff out, because there really is not a basic test that says the pet has allergies. I mean, just the general
test.
It's
just process of elimination.
That's exactly it. Well said.
Okay. So then for us, well, maybe I'm dumb, but I don't think there is a cure for allergies, correct?
Well, what we can do, and usually I will refer this to a veterinary dermatologist, but in our practice, most of us can take a sample of blood and we can find out exactly what the pet is allergic to. And many are allergic, like especially if it's more of a year-rounder, like dust mites in the house. We all have dust mites all over, and many, many animals are allergic to that. But anyway, then we send the results to a company, and they can actually make the allergens, the thing that is setting off the allergen, and they can send it to us in an injectable form for the most part. And just like people that take shots, you give just a very little bit of the allergen. Hopefully the pet will not overreact. That's what an allergy is. It's an overreaction of their body to something in the environment. And over weeks, you gradually build up the amount of allergen, and eventually the body does not become sensitized or overreacts. So that's the main treatment, are the injections, like a fair number of kids or people do. So we can give injections of whatever the pet is allergic to.
Yeah.
But it can be quite expensive, and often the pet owner has to give an injection once a week for potentially months. It's probably 80-85% effective. So it's not 100%, and it can be up to a year before you find out
if it's
going to work. So it's a little bit tricky. So that's why, because of the cost, a little bit iffy. That's why a lot of people will, okay, doc, give me something that can make the pet more comfortable.
Yeah.
And so that's what we primarily concentrate on in our general practice for the most part.
Okay. So then pollen, well, you say you were talking about dust mites
Yep.
that they were allergic to. What are some popular environmental allergies that are amongst cats and dogs?
Well, it depends on the season. Like in the spring when the trees are starting to bloom, it can be different different allergens from the trees themselves.
Okay, so pollen.
And then as we get more rain in the spring, kind of later spring, then pollen becomes more of an issue. But oak trees are different than maple trees.
Yeah.
And so a lot of times if we do run the test, I mean, there's probably 50 to 60 different allergens that we check for.
Oh, wow.
From the environment to see what the pet is allergic to, if the folks want to find out what is actually causing it and then want to give the injections to their pet.
Yeah. Is there is it just then the amount of self-harm that the pet does is what escalates the issue? It's not
Definitely.
Anything where
well,
it's
you know how you and I, let's say you get a little poison ivy or just a little rash.
Yeah, you just can't help it.
The more you scratch,
yeah,
the worse it becomes.
And
some animals, I mean, literally will mutilate themselves, or they develop what we call hot spots. It's just matted hair. Okay, hold the food again. But it's just kind of weepy lesions that get on there, and the hair mats, and it smells, because eventually from all the scratching and the mutilation, they will develop a secondary infection. Then it gets more complicated, because if you just treat with allergy medicine, that's not enough. You need to start treating, start bathing. And so the other high point is, if you feel like you've had an allergy problem, or last spring you did, most likely it's going to happen this spring, why do you wait till the pet is mutilated? Start the allergy medicine right away. And awfully, you just have to treat them with the allergy medicine, not do the bathing and all the other stuff. So procrastinating with allergens is not helpful to the pet or to your pocketbook.
Are there over-the-counter medications, kind of like what we
10
have?
10 to 15% of the time, which works much more effectively for people, you can do the Zyrtec, the Claritin, and Benadryl.
Oh, those will work too.
10 to 15% of the time. That's the problem.
Yeah.
And for many, many years, until about 7 or 8 years ago, the other option was oral prednisone or cortisone. It worked fabulously, but the problem is it has a lot of side effects, like those that you that may take prednisone for whatever issue you have. It often makes the pet and person drink more, then they urinate more. It often stimulates their appetite. I've had pets on the prednisone, and people call a week later, well, my pet's peeing in the house and I can't feed it enough food. Well, then I know right away it's the prednisone that's causing it.
Yeah.
And so we'll try to drop the dosage to minimize side effects, but still keep the itching under control. Well, 5 or 6, 7 years ago, they developed an injection and pills that work fabulously. Unfortunately, they're quite expensive. It can run anywhere from $60 to $100 a month for these medicines or the shot. So it's a lot more effective than the antihistamines, the Zyrtec, or the prednisone we had before. And so often if people are going, well, I don't have a lot of money. Well, you know, the allergen is not an emergency. If you want to try the antihistamines, the prednisone, see if we can get the pet more comfortable with that. That's perfectly fine. But if it doesn't work, or we have too many side effects, then you're probably going to have to suck it up and use these other medications, which are very, very effective. They work great, but they're expensive. So
there's options to start small, see if it works.
That's the way I like to operate it.
Yeah.
I mean, if the pet is heavily going after itself, you know, the skin is just a complete disaster. The people are just flabbergasted. Somehow money does not seem to be an issue. Then I think I'd be much more aggressive. But to do it. But if you're one of those, well, let's try this. I say, you know, try medicine for 2 weeks. If it doesn't get any better, it's not going to work.
Yeah.
You know, you don't have to go on months and months trying the Zyrtec to see if it works or not.
Yeah. Well, it's just human nature. If you've experienced enough pain, you'll eventually give in.
Right.
And go for
and most of us can empathize with our pet. When it itches and scratches, it just drives all of us crazy. And of course, in the middle of the night, they like to scratch more when you're trying to sleep. The pets. So
always
so
the perfect
gives motivation.
Timing. Yeah, and I would imagine I would probably imagine myself doing the same thing. Is that I would take care of my pet first before I take care of myself. So they'll have the first and best treatment before I do.
And I'm always amazed how many people have allergies, and the pets have allergies as well. So I kind of tease. Must be a genetic thing. But, you know, whatever
runs in the family.
Have, they pass it on to their pets.
Yeah, yeah. Well, in our case, no alcohol. So, Okay, so pollen, it's another one. Are there any allergies that humans typically won't have that pets will?
Short answer, other than flea allergies, most people don't get bit by fleas unless their pets have fleas.
Okay.
But I would say fleas are probably the main thing most people don't get. But for the most part, that's an excellent question. But I feel pretty comfortable in saying pets are pretty much allergic to the same stuff people are. They just, again, show it differently, and we may have to handle it differently than with humans.
Yeah. What about food?
Food occurs 2 to 5% of the time. And, of course, a lot of people want to jump on I tried a food allergy before they even call me because the pet continues to scratch, because it's much easier to do a food than trying to give these expensive medications. Or even if it's a Zyrtec or Claritin, you have to do it once or twice a day on a regular basis, or the pet's not going to be comfortable. But it's way overestimated how often food allergies occur. And the problem is I think in the next year we'll have finally something. There are food allergy tests available, but they're very inaccurate. I know people have done them, but they are not very good at perceiving what exactly the pet is allergic to.
Okay.
And I'm pretty comfortable, all the studies I read, that the protein is what causes the problem for food allergies, whatever the protein is. And most foods for cats and dogs are made out of chicken or beef, relatively inexpensive, but very good nutritionally. But if we do develop a food allergy, there's a good chance it's the beef or the chicken.
Okay. I imagine it's not the same reaction as environmental allergies, right?
Well, unfortunately, it can be.
It can be.
Sometimes food allergies are more in the bottom part of the body, but I cannot look at an allergy dog and tell you. I feel that if they do not respond well treating for environmental allergies, or it occurs like this last January and February when we had the cold weather, I don't think there was too much mold or pollen in the environment.
Yeah.
And if a pet, now again, it doesn't rule out the dust mites. I mean, if you have dust mites, that's a year-round issue. But if a pet is licking, scratching, biting itself in January or February in St. Louis, then I'm kind of thinking maybe it's more food. Allergies are generally, I've had people come in the middle of each August, like, we're going to have middle of August in a couple of weeks, and they're ready to get more medication for their pet. It's just like a calendar in some cases.
Yeah, routine.
It just starts because then that's when certain things are coming on, pollen or mold or tree-wise, that we don't see other parts of the year.
Yeah.
But the food is usually a year-round problem. So if a pet's having year-round problems, and you can have both. There's no reason in those horrible cases pets can be allergic to environmental stuff as well as the food. So that's kind of tricky sometimes. Yeah. But I just don't want people to get the idea you can jump right onto food, because it's most likely, statistic-wise, it's most likely not
food related. Okay. So then you may have brushed up on it, but so would the reaction be like the pets are throwing the food back up, or?
Good point. Yes, often it's more digestive if it's a food allergy. Yeah. Chronic vomiting, diarrhea, and so yes.
Okay.
That's a very good point, because pretty much 100% environmental allergies are skin.
Yeah.
Because
surface level.
Right. The mold and pollen is getting on the skin of the animal, and we think animals that are more prone to allergies have defects in their skin, because usually the skin's a pretty good shield, but if they have the defects in the skin, then they're more likely to become sensitized or have overreaction to it. So,
gotcha.
So you're exactly right. And if it's more digestive issues, then food allergy would definitely be on it. So excellent point, Kelvin.
Thank you. Yeah. Are all pets created equal?
No.
Where
it's a genetic thing.
Genetic thing.
If I have a Labrador Cocker Spaniel come in,
uh-oh.
And of course, that doesn't mean everyone gets it, but we definitely see, and part of it's because of the popularity, but we definitely see a lot of Labradors and Golden Retrievers come in for allergies. Now, they're in the top 3 or 4 most popular breeds, too, but I think those breeds spend a lot more time outside than maybe the little Chihuahua. Grandma won't let the Chihuahua outside. So we don't want to get hurt or anything type. But
okay. I have a friend, he volunteers at Care STL, which is a humane shelter down towards the city.
Yep.
They have a lot of pit bulls. Is there anything that they should watch out for in terms of allergies that are prominent?
I'd say they're kind of in the middle of the list. I
don't
think they're a high prevalent species to get that. So I would not be quite as concerned. But again, if they start getting the chronic itching, licking, don't have mites or fleas, then there's a good chance maybe allergies. But they're not a high...
They're not susceptible to more allergies or more sensitive to it.
Right.
Okay. Well, that's good to know. I can relay that message to him. Then last time we talked about a case study of yours, and you had another one that you wanted to bring up, but we didn't have enough time for that. Why don't you talk about it in this episode?
In the previous episode, we had talked about the zebras and the horses, that most of the time, most cases are fairly common, and if you're looking for that exotic case, you're probably wasting the client's time and money because often we'd have to run more tests.
And just to clarify, it's not a physical zebra or a physical horse.
That's great. It's just our terminology.
It's like a unicorn case that comes in, a zebra case or a horse
we don't
case.
see a lot of zebras that come in, and so it's kind of more of an unusual, and so that's how we got the terminology to an unusual case. So as general practitioners, we see quite commonly, urinary, skin, digestive issues. Yes, if you have a veterinary dermatologist, they're going to see more exotic skin cases that we don't pick up on. But anyway, even in general practice, we sometimes will see unusual cases. And so I had kind of an interesting one from many points of view. A lady that works at Carter Pet Hospital, had worked at Carter Pet Hospital where I work now in Lake St. Louis, brought her pet in, and she was not again working. I hadn't met her before. Apparently she's one of our people at the front, receptionists. And she brought her dog in very, very lethargic, a sudden onset. And what made it a little more complicated is that the pet was intact. It had not been spayed. And many older unspayed females that go into heat periods twice a year eventually will develop problems with their uterus. They'll get all kinds of pus or infection in the uterus. It's called the pyometra, and it is life-threatening. Most of the time, to resolve it, we have to spay them. So it's a good reason if you have a puppy. We see some pyometras in kittens, not very often. But anyway, one of the reasons why we recommend to spay a dog relatively young is so they do not develop this particular condition. But she was smart enough to know sudden lethargy. It was a month after the pet had their heat period. That's classic for pyometras. And so she came in and says, I want x-rays taken. I hadn't looked at the pet yet, but I thought, well, that's not a bad idea. The x-rays would show me if there's enlarged uterus. It was not there.
Oh my.
It was not a uterine problem. And so,
well
we
easy
need
to
do
eliminate.
some blood work. She agreed. Money did not seem to be an issue. She really cared about her pets. I think she was single by herself. Pets were everything in her family, and she agreed readily to blood work. And I look at the blood work, oh my God, the kidney enzymes are off the scale, which would indicate kidney disease or failure, and that can be very serious. And another thing that set me off was the potassium was very high, and that indicates the kidneys have suddenly failed, and that's usually a pretty poor prognosis. So I said, well, I think it's kidney disease. I think that things are guarded. We'll see how the next day or two go. Well, she agreed to start fluids, so we put an intravenous catheter in the animal's arm, and I think we had it for about 5 hours. It gave her for fluids, and the pet seemed to be doing a little bit better with the fluids, and that was kind of strange because usually with this nasty sudden kidney failure, it takes more than fluids, or usually even spite fluids, they pretty much pass.
Oh, really?
The next morning I called her, and I said, well, how's the pet doing? She says, well, it's better. It's still kind of weak. It's not eating. Well, that night I had done more homework, and it turned out that not only was the potassium high, but the sodium was low. The electrolytes were off, and that is a classic condition for what we call Addison's disease. This is where the adrenal gland does not produce enough hormone. For those that are older, John F. Kennedy, the president, had Addison's disease. It's pretty unusual. We hardly see it at all. I maybe see one case a year, maybe one every 2 years. It's a very unusual case, but the adrenal gland does not produce enough hormone, cortisone in this case, And with the lack of cortisone, the body just kind of goes limp. Because when we get nervous, excited about something, the body produces excess cortisone, and that's how we thrive. But if you're not producing enough, your body just wimps out. It just becomes very weak. And when I saw that, I said, I'm pretty sure it's Addison's disease. We did run another test that specifically tests for it, and sure enough, it was the Addison's disease. I was able to give a cortisone shot, and it's amazing, within 24 hours, the pet was doing a lot better.
Oh, wow. That's good.
So, but I kind of told her, it's kidney disease, or she thought it was the pyometra, not a good thing. And the Addison's is not curable, but the pets have a very good quality of life. Usually we have to give an injection every 4 to 6 weeks to treat it.
Okay, so there are
follow-ups. But it turned out the zebra was this very rare Addison's disease that we saw, but the initial blood work didn't lead me that way. It kind of made me think, had some other things going on. So there were a lot of twists and turns. So at least it was interesting to me, maybe not the general public, but sometimes, if we're not right, we may require more testing, which she was good enough, but I know it adds more expense, and it's frustrating to the average pet owner. But again, sometimes things require more testing and more thinking and more time to figure out what's going on.
Yeah. So does not trying to come off in a wrong way, but does it get your heart pumping and excited that you have certain cases that are like, oh, I can't figure this out? It becomes a challenge. Like, do you get a?
Oh yeah, we get worked up, and we have 4 other veterinarians, and sometimes I'll grab one of the veterinarians, show them the X-ray, show them the blood work. What do you think?
Yeah.
Because sometimes, oh my God, they bring up something I didn't even think of. So it's kind of nice to have a multi-doctor practice.
Okay.
But sometimes, even when I get 2 or 3 of the doctors together, we're all general practitioners. God dang it, we just can't put it all together.
Yeah.
And so then usually we recommend to the pet owner a specialist.
Okay.
Because there's internal medicine specialists. As I've talked about, there's the veterinary dermatologist specialist for behavioral issues and blah, blah, blah. And sometimes the case is just more complicated, or we just can't, get enough, or they maybe have more sophisticated equipment. Sometimes a CAT scan is required. We have X-ray machines, but we don't. Each practice does not have a CAT scan.
Yeah. Yeah. Okay.
So I don't know if I answered your question.
No, you did.
But I try to ask my fellow veterinarians and do more reading. Sometimes I shouldn't tell the pet owners, but sometimes I'll step out of the room and grab my book and just see, okay, is there something I need to think of before I go back in?
Yeah.
And so
let me talk to my manager real quick. Yeah.
And of course, being the old guy, I look at the book. Yeah, sometimes there are very good veterinary channels that I can look online. But I'm, because
tried and true method for you. So
that's the way I, look at my research. But anyway, if the veterinarian steps out, maybe they're trying to get a little bit of help. So don't tell anybody. But so it is. But on the other hand, I was just elated that finally we got the right thing. In this case, the lady had because she worked at a veterinary hospital, she knows the ups and downs of cases. And so she was good enough and patient enough to put up with it, and that helped. Yeah. Because, of course, the average pet owner doesn't know that, animals only get 5 diseases. I wish that was the case. Yeah. But each animal has unique diseases. Cats have different ones than dogs, then a hedgehog, then a hamster, then a guinea pig, and so forth. And so it can be very challenging to find out with each unique species or to keep up with it. So.
And like you mentioned in the earlier episodes, generally pet owners, they would freak out if you misdiagnose or you need to continue chasing.
Occasionally they get so upset, I'm just going to go elsewhere. Yeah. Occasionally we've had lawsuits with it. Yeah. I mean, and again, I understand where they're coming from. It's frustrating, and just like human doctors, I mean, sometimes we miss the diagnosis too. I mean, I do the darn best I can. I mean, I do a lot of research and talking to other people, but sometimes, we just mess up, and I feel bad about it, but it wasn't intentional. And again, it's just sometimes you just need another pair of eyes. And a lot of times if I see somebody frustrating, I say, I'm just going to give you some names. Maybe they're just another general practitioner, but just go to another person and just get their thoughts. Because
have a fifth opinion.
I know they're frustrated with me, and I understand, but sometimes I don't know.
Yeah. exactly.
And I think most people prefer that you're honest with them and say,
yeah,
maybe
better to be straightforward.
Instead of just, well, let's do another test, even though I don't really know what's going on, but maybe I'll get a little more money, or maybe it'll help me.
No, 100%.
But you're kind of going in the dark or walking blindly, and that's not fair to the pet owner.
Yeah, so. I've had that case with my mother. She had to get her thyroid checked, and they had to do biopsy, and she's done it twice now, and after the second time they kept telling her that it was not a sufficient enough sample size to determine, and she came to the conclusion like, well, I've had this condition for decades now, and you're telling me that I need to continue to do this biopsy enough for you to get a decent enough sample size. Right. Like, she'd rather just live on with it just because, it's 30 times the charm. I mean, who knows how many times you're going to have to continue to do the biopsy. Yep. So I get the frustration from both ends, like sometimes it's not the hospital's fault that, it's just, it is what it is. You just have to proceed on with it.
Well, real quick, Calvin, we have a lot of animals that come in with skin tumors of one sort or another, and people want me to look at it and say if it's benign or malignant. Sometimes if it's a certain shape or age of the pet, or I can feel like a fatty tumor, I know, but the vast majority of the time, if you want to know what it is, I have to stick a needle into the growth, pull some cells out. Well, some growths are so hard and thick, I just can't get a good sample.
Yeah.
And the only way, if you want to pursue it, is to do surgery and that type of thing. And again, it's not my fault or technique. It's just the type of growth that's going on. But again, people are frustrated. Oh my God, I got to do this again, or I got to spend all this money for a surgery when you couldn't get an answer for doing just the aspirate. So it just, that's the challenge. And sometimes those are the bad days when you feel like you did the best you could, or maybe I didn't communicate properly, or they're having a bad day. They always say you never know what the other person is going through. Yep. And so I try not to take it personally. I mean, if they've just lost a spouse, or the kid is really sick or something, and now the pet is sick, well, it's not going to take much to get them going if that's the case.
Well, luckily for me, my mom is not fluent in English, so I am the middleman between the doctor and my mother. So sometimes I don't tell her everything that the doctor says, just because I know how she'll react.
Right.
So I just be like, yes, I did. Yes, doctor, I did translate everything to her. Blah blah blah. She understands. Blah blah blah. Where I look over and my mom's like, what did they say? So I get that, and I just have to sometimes just make the decision of like.
And medicine can be an art. I mean, it's not always black and white. Or if I put my finger on that page, I always thought in school, like a certain condition, you had to have all the signs, or that wasn't the disease. Yeah. Because that's how the professors presented it. Yeah. They would get a classic case of an animal, and they would present everything.
Yep. Very cookie cutter.
Right. Yeah. But in many cases, that's not it. Yeah. And if it only has one or signs, well, I think that may be it. But, so it's just not always easy on presentation and history and all that. But
like the younger generation says, math doesn't always math.
I like that. I haven't heard that, but I like that.
It's never always, there's always some variables that change the circumstance. So, but I mean, thankfully, my mom, I want to say she knows her body better than anybody else. Yep. And she doesn't feel like there's any sort of change in condition or anything like that. Granted, most people, just because you function normally doesn't mean everything is okay, but as for now, all of her normal blood work and all that stuff checks out. So,
were they suspicious? Maybe there was like a thyroid tumor or something, or was that a list of possibilities?
Yeah, they wanted to be sure, and because it was over a span of 2 years that they were checking on it, just by examining it. Yeah, and it wasn't growing or anything like that. So the doctor deemed that it wasn't a critical condition or anything to pursue. So overall, she knows herself best, and the only thing I could do is just say, maintain the routine checks, and we'll go from there. Yep. So back to pets. Enough of humans. Enough of humans.
I'm not sure I can help you too much. Yeah. Though I have had some pet owners come in and they liked my bedside manner, and they said that they'd like to come in themselves.
Yeah.
And I said, I know my limitations. If a human doctor comes in, I don't want them telling me what to do with my pet or give me the diagnosis.
Yeah.
And it's
vice
the same
versa.
with you.
Yeah.
So I get flattered that they enjoy being with me, but I will not pursue the trying to diagnose your condition.
Yeah. So you brought up an interesting point earlier of patients or the pet's owners getting frustrated with you, and you suggesting them to find somebody else to get a fifth or sixth opinion.
Yep.
So I found on the internet a Reddit user. There's a little bit of a segment that I'll read to you, and just to want to get your thoughts on it. So the topic is a new veterinarian refuses to allow Chewy, the brand, prescriptions, or maybe it's just like the soft chewing prescriptions. Says that they want us to use their pharmacy.
Yep.
And the price markup is bonkers. Is this common? So, so the user wrote, just wondering, is this a common thing? I've never had a vet that wouldn't work with Chewy, and I guess it's the brand now, and I always ordered my scripts through there. This vet told me, we want to provide the highest quality care, so we don't work with Chewy. Now I have to either mail in a written script to Chewy, which takes a month, and they aren't writing anything longer than a single month refill, or switch vets. Has anyone else dealt with this, and what did you do? Is it really that hard to authorize scripts for customers through Chewy? That seems crazy to me that they aren't allowing that. Should I switch to a new vet?
A short answer to that part, if we can expound on it, I have a lot of comments on that, but you cannot go with the veterinarian because they want the money for themselves. In the past, not so much now, but in the past when only veterinarians would supply like the flea and the heartworm medications, preventions, we could really raise the price quite a bit because people had nowhere else to go.
Yeah, monopolized.
And so it turned out that a large percentage of the money that came in our front door, and of course in hindsight it wasn't right, but was due to products that we sold and not as much to medicine. Well, we were trained to be medicine people. But anyway, 15, 18 years ago, all of a sudden, a lot of companies started, I don't quite know for sure how they're getting the medications. I don't know if they're getting directly from the company or if some veterinarians are selling their own products. But anyway, there are a number of places online, like Chewy.com, that they can get, that the pet owner can get the product now. And as competition, and because I think they have so much of the product, they don't have the overhead that we do as veterinarians. If we own our own practice, the building and all that, they can charge a much lower price. Not a lot lower, but it's a lower price.
Without the markup.
Right.
Yeah.
And so we were frustrated initially. Oh, my God, we're going to lose all our money. What are we going to do? But we found out that we have other services that Chewy.com, they're not going to spay. Chewy.com's not going to spay your dog.
Yeah.
It's not going to run blood tests to find out what's wrong with your animal.
Yeah.
And so forth. So we need to charge in that and rely on less money. I mean, this is a philosophy. I'm answering that part of it. We're just going to get less money or income from the medications or to sell. But I think it's wrong not to give the people that option because we have the same thing.
Yeah.
Every day I sign 10 to 12 forms that I give permission for the pet owner to buy the money to purchase the product from
elsewhere.
Chewy.com.
Gotcha. Okay.
Because I would want the same. I mean, if a car dealer, if I could get a part of a car, buy my own oil cheaper somewhere, I don't change my own oil. I'm willing to pay them for it. But if I can get the oil cheaper somewhere else, why would I want to buy their oil? And I don't think it's fair if they say, well, we're not going to let you do that.
Yeah.
You can only get the oil from us.
Yeah.
Even though it would cost more.
Yeah.
So I just think they need to go another doctor. I don't agree with that doctor's philosophy. He or she needs to agree with it. I mean, she's going to lose the pet owner anyway, even if the lady doesn't think about it. Why would you want to go to somebody of that
Yeah.
of that sort.
Is it worth the trade-off?
It isn't.
Yeah.
It isn't.
Yeah.
You're not going to keep a pet owner just. Yeah.
Great.
So,
Yeah.
so it's become very common, and we've tried ways to. I mean, we have had, and I don't agree with it. I've been at clinics where the people have to come in and pick the written script. We can't just call the pharmacy. I mean, like a Walmart or Walmart, Walgreens.
Mm-hmm.
A lot of those sell drugs that we use for animals. Costco.
Yeah.
And why would a person have to come in to get a script and then take the script to the local store if they don't get it online?
Yeah.
Yeah. That's just bad. I mean, it's just bad relations.
Yeah.
Pet owners. I mean, a lot of them are my family and friends. I probably have told the joke maybe on the podcast, but a lot of times people I've known for years and years, I see them once or twice a year. They come in, oh, what's going on? Or did your daughter get married? And I have 30-minute appointments, and the joke is after 20 minutes, oh my God, I haven't even looked at the pet. We've been talking, catching up, because we just enjoy each other. We become like family.
Yeah.
And I feel that they are comfortable with the way I practice medicine. But sometimes it almost gets out of hand. I'm talking too much to them about the family and that type of thing. But that's how you build up a practice where people come in, and I think you just have to compromise. And yeah, you lost money on those products, but that's the way it is. That's the American way, or the capitalism. There's competition.
Yeah. That's just the way that things are moving from now on. Yep, exactly.
And shame on us in hindsight. We just charged way too much before because we could get away with it. That's not right either.
So you would say that it's more of it's coming to balance now rather than anything.
It's a lot better. It's much fairer to pet owners. They have their choice.
Yeah.
Now, a lot of them like the convenience, or they like me enough. I'm willing to, even though they know it's going to be a little bit more, they're willing to compensate me for doing it because I'm their friend. Or
I want to come by and pick up a prescription and talk to you a little bit.
Because I can get it right away. I mean, a monthly prevention, there's no hurry, but sometimes it's aggravating to have to wait for the shipment, whatever it is. I like these people. They've been good to me. So
and
I think it pays off if you're just good to the people, even though you're going to lose some with the products. I'd say probably 25% of the people at this point buy their products online or from another competitor. Well, that's 75% of them we still get our price. And we are much, much more competitive. We know we have people that are competing against us, so we don't make that much of a profit with it, but
it's not worth the trade-off of losing the loyalty.
No.
Of
and the business,
patient.
because people will come in, the products are just one aspect. There's just so many other services that we provide. We just need to push the money issue with pharmacy to the side. Great if they want it, but if not, then you provide the script or you call it in. That's just the way it is.
Well, great.
So interesting, great question.
Yeah, I mean, definitely hearing that from you, it makes me feel like there are, there's still good people in the world.
There are.
We just want to do good things.
I mean, many years ago, I had heard of a veterinarian that a person would bring a stool sample in, even if it wasn't positive for worms, he would still give medicine to the people, telling them that the pet had worms when it didn't. Yeah. Because he wanted extra money for the worm medicine.
Yeah.
Well, there's no need to do that. There's just so much other stuff you can do.
Yeah.
And so
I think that's
so
lazy
like any
practice,
profession, we have good and bad people, and I'm embarrassed with the bad people, but if you're not comfortable with your veterinarian, go somewhere else.
Yeah. There's plenty more.
You just got that bad vibrations, or whether it's your dentist or human doctor. I went to one dentist. Overall, my teeth have been in good shape, and I went in, and he said, "Well, you got 20 teeth that have cavities." Nobody had ever told me that before.
Why now?
Yeah, exactly. Yeah. And then I need to have my teeth extra cleaned. I don't know the procedure, but he just went on and on all the different things I needed, and I just felt,
do you want the basic wash or the premium?
Exactly, and I didn't think I needed the premium wash in this case. So I just, as veterinarians, I just want people to do the same. If you're not comfortable, just go somewhere else. But I just think that one person, in my opinion, did a bad thing. Yeah.
Well, appreciate your honesty. And,
well, thanks for getting me all worked up too. Now I'm really sweating. It's not just the hot weather. I'm kidding, but it's just one of those things that we just have to do what people want.
You mentioned something earlier, and we don't have time for that today, but it brings up a good topic for the next episode, which is something I'm interested in. It might be a fun episode for us to talk about. Is internal. Well, I don't know what the episode title should be called yet, but internal code or lingo that gets used around the office. Because you mentioned about zebra cases and horse cases. I wanted to know more about what's the vet language that you guys use.
Now, are you
offices?
talking about like clients in general, their characteristics or personalities, or
anything? Well,
okay.
We can.
Okay.
It's an open book.
Okay.
We could be as controversial or as humorous as we want it to be, but I think it'll be a cool insight to know, if you guys speak in code within the office, or how do you guys communicate efficiently and all that. So.
Well, I think, especially with my younger coworkers, the veterinarians, the doctors, I think a lot of times they talk over people's head.
Uh-huh.
I try not to do that, but we spent 8 years in school learning all these fancy words.
Yeah.
And you just feel like the whole world should know what that is. Well,
Yeah.
I've been in practice long enough. Most people, don't know those words. You have to use it in their language.
Uh-huh.
Like for a while, I was telling, well, could you bring your pet? Could you have your pet bring in a stool from your pet next time?
Mm-hmm.
What's a stool?
Yeah.
So I had to say poop or feces, or maybe I said feces at the time or something.
Uh-huh.
But I remember a number of my clients didn't know what I was talking about.
Yeah. Yeah.
So it's just trying to figure out that you're communicating well and not using the big words. Or maybe some of the doctors are trying to impress people.
Yeah.
Using the big words. But if you can't communicate to the pet owner, you're not going to do any good.
Yeah. We'll do a little bit of a teaser.
Love it.
We'll do a little bit of a teaser. So like one thing is, the new generation, they use a lot of different slang, right? So would you, I'll have more terminology for you to guess on the definition of.
Because I'm a baby boomer, so I can be a couple generations different than some of the pet owners that I see now.
Yeah. So for example, one of the terms would be like, do you know what your younger coworkers mean when they say cap?
No. And we have talked about that a few times. We're off from noon to 1, and sometimes we'll get together and they'll start throwing me terms.
Yeah. Like Gen Z slang, and then you're like, oh, well,
No,
maybe the next episode we can educate you and you can be in the loop.
Please.
So you can bring it back to the office and you can say, they can be shocked and be like, whoa. You're not old anymore. You're keeping up with
I'm hip or something.
Yeah,
like that.
yeah, exactly. Well,
that's what I would use.
They would call you if you're an older generation, you don't get it. They'll call you an unk, short for uncle. Like
I have heard that.
Yeah. So we'll save that for next episode. The next time.
That's great.
Cool. All right. Thank you again for your time, Dr. Lang.
Thanks, Calvin. This has been a good hour on this episode.
And then if you guys feel like you've learned something from us, maybe you didn't know your dog or your cat has allergies from pollen or a specific type of food, and now share it to somebody that you think they might get some knowledge from this or some value from this. And don't forget, as always, like, subscribe, and comment down if you have any questions pertaining to your pets. Doesn't have to be allergy related. It can be anything just related to pets, small pets, correct?
Yeah, we call them companions, like dogs and cats and the pocket pets. Again, I'm not a lot on the reptiles, some birds, but I do not do farm animals or equine horses, so it would have to be what usually you can put in your house or your garage is probably acceptable.
What's allowed when in your leasing agreement when you're renting a space?
There you go. I like
we'll
that.
talk about those. So drop the comments down below. If it's urgent, call your local vet ASAP. Don't wait for us to answer that question. Anything else that pertains, just general curiosities and questions, just leave them in the comments, or email us. And thanks again, Dr. Lang, and we will see you next time.
Sounds great.
Thank you.